Welcome to University of Houston HCA Healthcare Kingwood General Surgery Residency Program. I'm Dr. Mike Liang. I'm the General Surgery Program Director. I've been in Houston for over a decade, and I was recruited to become the Program Director and build one of the premier general surgery programs here in the United States and in Houston. Houston is the third largest city in the United States, and it offers an amazing diversity of culture, social activities, restaurants, and community. Here you can find a wide diversity of people and cultures and food, and it's one of the greatest places to train in America. University of Houston and HCA Healthcare collaborated to form the General Surgery Residency Program here at HCA Healthcare Kingwood. Our goal here at HCA Healthcare Kingwood is to build a strong general surgery residency program and train surgeons to be well equipped to become community surgeons or have the qualifications to match into highly competitive fellowships. Here at HCA Healthcare Kingwood, you'll have an opportunity for early engagement in the operating room, extensive simulation training, and a great community of diverse doctors that are focused on wellness. One of the goals of our program is to provide a great education for our surgery residents, both in and out of the operating room. In order to improve the quality of education, we have weekly morbidity and mortality conference, grand rounds, and education and simulation training. During our grand rounds, invited speakers from across the country who are content experts in their subjects come here and provide lectures and teach the surgery department here about cutting edge changes occurring in their specialty. Following the grand rounds, these content experts stay to provide one-on-one education with the residents and the faculty, going over what you might expect from different cases and in the oral board setting. In addition, we provide protected time for residents for simulation training. Currently, we're designing one of the largest simulation training areas here in Houston. In our temporary space, the residents get to have a few hours every week protected to practice their fundamentals of laparoscopic surgery, fundamentals of endoscopic surgery, open surgery, bowel anastomosis, and vascular anastomosis. All of these sessions are overseen by board-certified faculty here at HCA Healthcare Kingwood. Scholarly activity is one of the core components of general surgery education. In order to enhance our scholarly activity experience for residents, we provide a formalized curriculum for both the faculty and residents. Here at HCA Kingwood, you'll have the opportunity to work with our Division Director of Research, our GME Director of Research, and have a research coordinator dedicated to work with you. We have multiple faculty who are highly published in their area of specialty. In addition, we have multiple grants, including a NIH grant where I'm the local PI for the Inspire grant. We won in this past year the GRAD grant to perform research on video-based education, and residents all have an opportunity to participate in this type of scholarly activity. In the past year in the HCA Gulf Coast Research Symposium, the general surgery residents presented 4 different presentations and were able to win prizes in both the oral presentation and poster presentation, and were invited to present at the National Symposium. It's expected that all residents participate in scholarly activity, and here at HCA Kingwood, we provide you with the resources and the faculty with the expertise to be able to successfully complete and accomplish your scholarly activity goals. HCA Healthcare at Kingwood collaborates with multiple other HCA hospitals, including North Cyprus, a women's hospital, HCA and the Medical Center, as well as the HCA San Antonio Transplant Center. You'll have the opportunity to visit and work at all of these hospitals. However, there's one thing in common at all of these institutions: an enormous volume of clinical work, along with highly trained and skilled faculty who are eager to teach and train you. Here at HCA Kingwood, you'll have the opportunity to be in the operating room immediately upon starting your residency. We expect residents to not only participate in the operating room, but also utilize their operating room experience as the foundation of their education to then connect with their reading and their education so that they have real world applicability to their experiences. In order to enhance your operative experience, residents have the opportunity to participate in simulation lab so that they can practice their skills prior to performing them in the operating room. These simulation labs include robotic training, laparoscopic training, and open suturing and stapling. This way, your first time won't be in the operating room, but your first time will be in simulation.
Hey, my name's Ali. I'm a PGY2 here at the Kingwood General Surgery Residency Program. What I really like about our program is that we're a very close-knit community. We always have each other's backs. We operate a ton. Even in your PGY 1 year, you'll find yourself in the operating room doing minor cases, big cases, bedside assisting, and then even possibly sewing towards the end of your intern year. We have a lot of different subspecialties we work with, especially vascular. We even have a head and neck rotation at Med Center, which is one of our other locations. If you're lucky enough to come here and we're lucky enough to have you, we're gonna have a great time. Thanks.
Hi, my name is Shrina, and I'm a surgery intern at HCA Houston Healthcare in Kingwood. When I was interviewing, I was really looking for a program that emphasized community and mentorship. I not only found that here in Kingwood, but also became immersed in a really strong operative environment. Kingwood has a high case volume, and there are more cases happening every day than there are residents to cover them. I started assisting in a huge diversity of general surgery, vascular, and thoracic cases on my very first day.
Hi, my name is Dr. Jose Lopez Vera. I'm one of the inaugural residents here at HCA Houston Healthcare Kingwood and currently a PGY4. I came to Houston not just because of the size of the city and the diversity, but also because I was looking for a program that had an emphasis on operative volume and community practice. So being a resident here over the last 4 years and seeing the growth of the program, we've seen a lot of expansion in not just the hospital, but to the community, which is an underserved surgical community here in North Houston. And also from a resident standpoint, it provides the benefit of giving us a huge variety and diversity of patient populations and pathologies that we've learned how to treat here.